fascinating today, huh? A blowhole colostomy.
Okay.
We've got some research articles, some surgical guides, and this is, one of those things that kind of flies under the radar, right? But it's actually, it's kind of a superhero in its own right. It's all
Mhm.
about speed in the ER when things are really, really critical. So, are you ready for some aha moments? I think we're gonna have some interesting insights here.
Definitely. Yeah, I'm excited. It's always fascinating to delve deeper into these, sort of niche procedures.
Absolutely. So I guess, maybe the best place to start is like, what exactly is this blowhole colostomy thing? I mean, it sounds kind of, I don't know, intense, right?
Yeah, it does have a kind of evocative name, but in essence, it's a really rapid technique, a surgical technique,
Mm-hmm.
and it's used in emergencies, right? So we're talking about situations where a patient has a complete blockage in their large bowel,
Oh, wow.
and there just isn't time to do one of the more complex procedures.
Okay, so it's not like, you hear about, loop colostomies or end colostomies. It's not like that.
No, it's not a formal colostomy. Think of it more as a quick fix,
Hmm.
a temporary measure to just relieve the pressure that's building up in the colon because it's obstructed. And in these situations, oftentimes the patient is they're just not stable enough
Yeah.
for a long involved surgery.
Yeah.
So yeah, every minute really counts.
Wow, that's intense. So how does it actually work? I mean, is it kind of straightforward?
Well, the surgical technique is it's very streamlined.
Yeah.
I mean, there's minimal manipulation of the colon itself. It's a small incision. They don't actually create a formal stoma
Okay.
or attach it to the skin in any way.
So they're basically making a small opening to just let things kind of pass through, I guess.
Exactly. Yeah, that's a good way to put it.
Yeah.
Just creating a temporary outlet for decompression.
Okay. Okay. So when would they actually choose to do this? Like what kind of situations are we talking about?
So typically, it's for acute obstructions
Mm-hmm.
on the left side of the colon,
Okay.
and these are often caused by things like cancer,
Oh, wow.
volvulus, which is like a twisting of the bowel,
Yeah.
or even toxic megacolon.
Toxic megacolon. Now that sounds that sounds pretty serious.
Yeah, it's definitely a serious condition,
Yeah.
and that's where things can get really, really tricky.
What exactly is that?
So toxic megacolon, it can actually be a complication of other conditions,
Okay.
like C. difficile colitis
Okay.
or ulcerative colitis. You might have heard of those.
Yeah, yeah.
And basically, the colon becomes very swollen,
Yeah.
like incredibly swollen, and there's a real risk of it rupturing.
Oh my gosh.
So yeah, it's a very, very serious situation.
Okay, so the blowhole colostomy, it's like a pressure valve almost
Yeah.
to sort of stabilize things until they can address, the root cause.
Exactly. It's buying time in these really, really dire circumstances.
Wow, so it's literally a life-saving procedure potentially.
It can be, yeah. Absolutely. I mean, we're talking about giving someone the best chance of survival
Yeah.
when, conventional approaches might just be too risky.
Okay. Okay. So we've talked about how it's different from other kinds of colostomies, like in terms of the purpose, but how does the actual process compare? Like we have this table here from one of the articles that compares blowhole with loop and end and double barrel colostomies. Is that a good place to kind of jump in?
Yeah, I think that's a great way to sort of delve a bit deeper. And one of the most noticeable differences for the patient, the cecal control.
Okay.
So with a blowhole colostomy, the output is uncontrolled. It's basically continuous, and this can be quite a challenge to manage. Whereas the other types of colostomies, they provide a more controlled output. So it's a little less messy, shall we say?
Okay, so with a blowhole, we're talking about a situation that's potentially pretty messy. Like what would that actually mean for the patient on a day-to-day basis?
Yeah, it can significantly impact their quality of life. Imagine like constant cleaning.
Yeah.
The risk of skin irritation.
Right.
It's definitely a downside. However, the trade-off for that inconvenience, right, is speed.
Okay.
So a blowhole colostomy can be performed, under 15 minutes.
Wow.
Whereas the other techniques, they can take up to 90 minutes.
15 minutes versus 90. That's incredible.
It's a huge difference, yeah. And in an emergency situation, that kind of speed can really be a game changer.
Absolutely. Yeah. Okay, so we've established that speed and minimal surgical trauma are huge advantages, especially in those emergency situations. But are there any other benefits of blowhole colostomy? Anything else we should kind of highlight?
Yeah, definitely. So besides being quicker, it also means less time under anesthesia,
Right.
which can be really, really important for high-risk patients.
Yeah, absolutely.
There was one study that I found particularly interesting. They actually found that patients who underwent a blowhole colostomy, they had a 2 day shorter hospital stay
Oh, wow.
compared to those who had a loop colostomy.
2 days. That's significant. And I was reading that in some cases the blowhole can actually close up on its own if the obstruction kind of resolves itself. Is that common?
That's true.
Mm-hmm.
But spontaneous closure isn't really something that you can count on. It's more the exception than the rule.
Okay.
Often a second surgery is needed to either, convert it to a formal colostomy, or to address the root cause of the obstruction in the first place.
Okay, so while it has some, potential advantages in the long run, it's not really a permanent solution in most cases.
Right.
So we've talked about, the good, the speed, the minimal trauma, the quick decompression, but let's be real. I mean, there's got to be some downsides to this procedure, right? I mean, it can't all be
Of
roses.
course. Every medical procedure has its risks and challenges. Um, and with a blowhole colostomy, because it's not a formally constructed stoma, um, there is a higher risk of complications.
Like what kind of complications are we talking about?
Well, there's the risk of prolapse, which is when the colon basically protrudes outward from the opening.
Ah,
There's stenosis, where the opening narrows, making it difficult for waste to pass through.
right.
And of course, there's always the risk of leakage.
So for the patient, that would mean, additional discomfort, potential infections, maybe even more procedures down the line.
Yeah, absolutely. And we can't forget about, the already challenging aspect of the uncontrolled fecal drainage, right?
Hmm.
It's just a really difficult situation to manage, post-operatively, both for the patient and for the healthcare providers.
Hmm.
Frequent cleaning, constant risk of skin irritation. It's not ideal.
Yeah, it sounds pretty intense. So it's like, while it can be a lifesaver in an emergency, it also comes with, a whole other set of challenges down the road.
Right. It's definitely a complex situation. There's a lot to weigh out.
Yeah, it highlights the complexity of medical decisions, I think. Speaking of which, one of the articles mentioned that a blowhole colostomy is sometimes called a Bogota colostomy. Have you ever heard that?
I have, yeah. That's really interesting.
And why is that?
Well, it seems like the name likely comes from the fact that this technique, um, it gained a lot of traction and was further developed in Bogota, Colombia.
Oh, wow.
So, it really speaks to the global nature of medical innovation and how knowledge and techniques are shared across borders.
That's pretty cool. I love how these deep dives always uncover something new and interesting.
Yeah, me too.
Okay, so we've really kind of dissected this blowhole colostomy from different angles, the unique surgical technique, the specific use cases, the balance of benefits and risks. But I'm curious, what stands out to you as the most important takeaway from all this? Like what's the big thing here?
I think for me, it's realizing that a blowhole colostomy really embodies the concept of compromise in medicine.
Right.
It's this incredibly powerful tool in emergencies.
Mm.
It offers this rapid, potentially life-saving solution, when time is really not on our side.
Mm.
But it's not without its drawbacks,
Right.
and it requires careful consideration of the long-term implications. It's not a perfect solution by any means.
It really drives home the point that medical decisions are rarely, black and white.
Yeah.
They're often shades of gray, there's trade-offs to be made, and there's often difficult conversations to have.
Absolutely. It's about finding the best possible path forward, given the unique circumstances of each patient.
Okay. So before we move on, I want to kind of pause here and ask you, knowing what you now know about the blowhole colostomy and its alternatives, what factors would be most important to you if you were facing this decision? I mean, it's a heavy question, but one worth kind of pondering.
Yeah.
And we will delve into, long-term outcomes, patient experiences, all that good stuff.
Yeah.
But first, I just want to kind of take a moment and reflect on what we've learned so far. Like what stands out to you the most?
Well, I mean, I think
I mean, it is a lot to kind of wrap your head around, right?
Yeah.
I mean, we're talking about a procedure that's like literally buying time, you know,
Yeah. Yeah.
in a life or death situation. But then, there's the potential for these messy complications and more surgery later on. It's a tough call, it seems like, no matter which way you look at it.
Yeah, I mean, I think you've hit the nail on the head. It's all about, weighing those immediate needs
Hmm.
against the potential long-term consequences.
Right,
And
right.
that's why it's so vital to have that, open communication between the patient and their healthcare team. Like they need to really understand.
Absolutely. Yeah. Informed consent, making sure the patient really understands, all the risks and the benefits, that's paramount in any medical
For
decision,
sure.
especially when it comes to something like, as life altering as a colostomy
Yeah.
potentially.
Yeah.
So what are some of the things that doctors would have to consider when they're recommending this blowhole colostomy to a patient? Like what are the factors that are going through their minds?
Well, I think, first and foremost, it's the patient's, overall health
Mm-hmm.
and the severity of the obstruction. Are they strong enough to potentially handle a more complex procedure, or is the blowhole colostomy really the safest option at that moment?
So it's really about making the best possible decision based on that individual patient's circumstances. It's not like a one size fits all kind of thing.
Exactly, yeah.
Yeah.
And then, you have to consider the underlying cause of the obstruction. Is it something that can be, definitively treated later on,
Right.
or is the colostomy likely to be, more permanent solution?
Okay, so there's a lot of factors at play here. It's not just about relieving that immediate blockage. It's about what happens
Yeah.
next. So speaking of what happens next, what does the research say about how people actually fare after a blowhole colostomy? Like, does it have a good track record in terms of survival rates and long-term quality of life? What do we know about that?
Yeah. Well, one of the studies we have here, it found that, a blowhole colostomy successfully relieved the obstruction in 100% of the cases they looked at.
Wow, 100%. That's pretty impressive.
Yeah. And interestingly, there was no difference in 30-day or in-hospital mortality rates
Yeah.
between patients who had a blowhole colostomy versus those who had a loop colostomy.
Oh, interesting. So in the short term, at least, it seems like both procedures are equally effective when it comes to survival.
Right.
But what about the long term? Does the research kind of delve into quality of life post surgery?
It does, yeah.
Yeah.
And it's important to note that long-term outcomes are very much dependent on the underlying condition, right, that caused the obstruction in the first place.
Right.
And then also the subsequent treatment plan.
Okay.
So, some patients may experience complications, like the ones we talked about earlier,
Hmm.
while others might, recover quite well.
So it sounds like there's a wide range of potential outcomes, and it's crucial for patients to have realistic expectations, going into the procedure.
Absolutely.
Yeah.
And
Mm.
that's where, those open and honest conversations with their healthcare providers are just so vital. Patients need to have a clear understanding of what their journey might look like, you know,
Mhm.
both the good and the bad.
Right, right. It's a reminder that even with these life-saving interventions like a blowhole colostomy, there's no guarantee of a smooth or an easy road to recovery. It can be a long and challenging process.
Yeah, that's true. But, with proper management, with support and with a positive outlook, um, many people can adapt to life with a colostomy and go on to live, full and meaningful lives.
Yeah, it's a testament to human resilience and the power of the human spirit to overcome adversity.
I completely agree.
Okay. So we've covered a lot of ground here. We've learned what a blowhole colostomy is, why it's used, the advantages, the disadvantages. We've even delved into those more personal aspects like patient experiences and the long-term outcomes. But before we wrap up this deep dive, I have one last question for you. Knowing all of this, if you were a surgeon faced with a patient in need of this emergency intervention, for a bowel obstruction, what factors would weigh most heavily on your decision-making process? Like what would be top of mind for you?
Hmm. That's a great question. Um, I think for me, the most important factor would be the patient's overall health and stability. Are they strong enough to withstand a longer surgery,
Yeah.
or is time truly of the essence?
Right.
That would be the first and foremost consideration.
So really assessing whether a blowhole colostomy is the safest and most appropriate option in that particular moment.
Exactly. Yeah. And then I would, consider the nature of the obstruction itself.
Right.
Um, is it something that can potentially be resolved with a later procedure,
Mm.
or are we looking at a more permanent colostomy?
Right.
That would influence the decision as well.
So taking into account both the immediate need and then the long-term implications.
Absolutely, yeah. And of
Mm.
course, I would always prioritize open communication with the patient.
Right.
Making sure they understand the risks and benefits of each option. It's about empowering them to make an informed decision, even in a stressful and time sensitive situation.
Yeah, it's a collaborative process. Even in an emergency setting, it's still about working together.
For sure.
Now let's kind of shift gears a little bit and talk about the future of this procedure. Where do you see the blowhole colostomy fitting into the landscape of surgical interventions for bowel obstructions, in the years to come? What do you think?
Ooh, that's an interesting question. Well, with advancements in minimally invasive techniques
Mm.
and surgical technology, we might see a shift towards even less invasive approaches for managing bowel obstructions.
So potentially even fewer blowhole colostomies in the future.
It's possible, yeah.
Yeah.
But for now, I think it remains a valuable tool in our arsenal, especially in those critical situations where time is of the essence. It's a reminder that sometimes the simplest solutions can be the most effective.
Yeah. It's fascinating to think about how these medical procedures evolve over time,
Hmm.
constantly adapting to new knowledge and new technologies. But for now, the low hole colostomy stands as a testament to the ingenuity of the surgeons who developed this life-saving technique. So
Absolutely.
yeah.
Yeah, it's a reminder that even in the face of challenging circumstances, innovation and compassion can pave the way for better patient care.
Well said, well said. So as we resurface from this deep dive into the world of blowhole colostomy, I want to thank you for joining us on this journey. We've explored the technical aspects, the ethical considerations, the human stories behind this often overlooked procedure, and I hope you found it as fascinating, as thought-provoking as I have.
Me too. Absolutely. It's been a pleasure sharing these insights with you.
And remember, this deep dive was crafted just for you. You now have a deeper understanding of this unique procedure, its potential benefits and the challenges it presents. And we hope this knowledge empowers you to ask informed questions and engage in those meaningful conversations with your healthcare providers. And if this deep dive has sparked your curiosity, we encourage you to explore further. We've included links to the research articles and the surgical guides in the show notes. So keep those brains engaged
Yeah,
and never stop questioning, right?
definitely.
Until next time, happy learning. It really is something, huh? Like behind every procedure, there's a human story,
Yeah.
a life that's been touched by illness, and that hope for healing. It's powerful.
Yeah, no, I think you've got it. It's like seeing the person behind the condition
Hmm.
and making sure they feel heard and understood and empowered,
Hmm.
throughout their healthcare journey.
And I think sometimes recognizing that, even with all the advancements that we have in medicine, there are times when the best we can do is offer a temporary solution, just a chance to buy some time and hope for a better tomorrow.
Yeah. I mean that's the reality, right? It's not always about finding a cure. It's about providing the best possible care and support in every situation.
Well said. Well, as we kind of resurface from this deep dive into the world of the blowhole colostomy, I want to thank you for joining us on this journey. We've explored the technical aspects, the ethical considerations, the human stories behind this, often overlooked procedure. I hope you found it as fascinating and as thought provoking as I have.
Definitely, yeah. It's been a pleasure sharing these insights with you.
And remember, this deep dive, it was crafted just for you. You now have a deeper understanding of this unique procedure, its potential benefits, and the challenges that it presents. And we hope that this knowledge empowers you to ask those informed questions and engage in meaningful conversations with your healthcare providers. And if this deep dive has sparked your curiosity, we encourage you to explore further. We've included links to the research articles and the surgical guides in the show notes. So keep those brains engaged and never stop questioning.
Absolutely.
Till next time, happy learning.